IV PCA is most commonly used with postoperative patients. Common medications used in a PCA are morphine, Dilaudid, or Demerol. The PCA is usually ordered by the anesthesiologist. There are components of each PCA that needs to be ordered. The first component is the type of medication the doctor wants to order. The next component is if they want a continuous infusion of the medication or not. Then you have the PCA dose, also called the rescue dose, or the bolus dose, which is used when the patient actually presses the button. The next component of the order is the lockout time, which is how often the patient can use it, and that's usually written in minutes. The final component is the 4-hour dose limit, which is the maximum amount of medication the patient can use within 4 hours. If that is reached, the medication will not deliver any more medication. As far as patient safety is concerned, prior to ordering a PCA, the doctor will have to make sure that the patient is an appropriate candidate. Young children, elderly, obese patients, confused patients are usually not a good candidate. Next thing that needs to be checked is for patient allergies. You should only accept orders for a PCA that are written on the standard PCA sheets within the institution. You can only take verbal orders if there is a change in the orders once the PCA is set up initially. To set up the PCA, there's a key on every nurse's station which will unlock the PCA machine itself. The medication is inserted in through here, and this is where you program the PCA for whatever settings the doctor ordered. Once the medication is all set up, it's locked. Then another clinician has to come and they have to check the patient and the orders and check it against what's programmed in the PCA. Once that is done, you can hand the patient their button and they can start their pain management. It's very important to instruct the patient and any family member present that only the patient should be pressing the button. PCA by proxy, when somebody else presses the button, can lead to oversedation. Once the PCA is initiated, the nurse must check vital signs including O2 sats, level of sedation, and pain level at least every 4 hours. One side effect of anesthesia is post-op nausea and vomiting, and narcotics can intensify that. So doctors usually order an antiemetic or an anti-nausea drug along with the standard PCA order sets. In addition, there must be Narcan and oxygen available to the patient if it's needed.